Hello. There's a lot of focus about cases and total case numbers in the state. The thing about the case numbers is that eventually those cases funnel into the ICU. ICUs across the state are a relatively limited resource. They're usually quite full. And the ICUs are really the centre of hospitals. It allows us to do things like heart surgery, complex obstetrics. It allows us to look after patients who've had multiple trauma. It allows us to do leukemia treatments. A whole variety of things need access to the intensive care unit. This disease is a disease where a small number of people who get sick end up in the intensive care unit, and they stay in the ICU quite a long time. Normally, patients in the ICU are there for 3-4 days on average. Patients who have COVID, who end up on ventilators, on the breathing machine, on life support, stay in ICU from the UK data something like 3 weeks. If you're in the ICU, you're on life support and you're on dialysis, you stay in the ICU somewhere around 5 weeks. So you can see how a unit which is designed to have patients coming through at high numbers, lots of throughput, all of a sudden these patients come in, they slow the flow down, they slow everything down. It makes the unit slowly fill up. We've got access to ICUs at the moment in Sydney, lots of room. ICUs are a combination of a very complicated bed, lots of infrastructure, machines, but much more importantly than that is ICUs are built around intensive care, and the intensive carers in our ICUs are the nurses. Our nurses are absolutely vital to providing the technical skills of looking after the machines, are vital to looking after the patients and recognising when they're getting sick, when they're getting better, and also to providing compassionate care to the patients when they're having the worst time of their lives, and the patients' families. COVID has really changed how we have to deal with families. We can't do face-to-face meetings. We have to do this digitally, and it really adds an extra layer of complexity. Looking after COVID patients is very hard work. It's really demanding. You're in layers of PPE, which is hot. Particularly for the nurses, it's difficult work. It's physical work. For the medical staff, if you're doing procedures, if you're doing operations on these patients, you've got the PPE and then sterile equipment over the top of that. It can be very difficult work. And these are really sick patients. So what we want to do is take these patients who are really sick and stop having them. We want to stop people getting sick and ending up in ICU. And there's really good evidence from all over the world that the vaccinations that we have available to us stop people, once they're vaccinated, stop people needing to come into hospital. Almost all the hospitalisation goes away. Almost all the need for ICU goes away. And almost all the death goes away once people have been vaccinated properly. And that's what we want to see. You take this disease, which in older people, 10-20% of people end up in ICU, and you make it a much more mild disease. A disease that can be managed as outpatients, it can be managed with telehealth and so on, rather than burdening the hospitals, overrunning hospitals. And we know from having looked around the world that when hospitals are overburdened, when they're running at overcapacity, more people die than would have otherwise.
Doctor, do you hear from patients who have ended up in the ICU, like we've seen in other parts of the world, that they regret not getting vaccinated?
Unfortunately, once patients come to my ICU, most of them are too sick to be talking to us. They're on ventilators, they're feeling really sick, and I personally haven't heard that. I'm aware of other people around who've been told that, yes.
Doctor, are you worried about the capacity of our current hospital system and the ICU system more broadly? Are you worried about that coping with the spread of this outbreak?
At the moment, the hospital system is responding really well. Everyone is pulling together. There are reconfigurations and a whole pile of stuff being done to help us cope. So at the moment, we're responding really well.
Doctor, how many ICU beds does a regional hospital typically have? How many sick COVID patients can they handle before they need to start transferring to a city hospital, patients away from their families and that sort of thing?
Most regional ICUs are smaller than big hospital ICUs, but it's not so much the number of beds, it's the amount of staff. And at the moment, the regional hospitals are well staffed, they're running okay.
Dr. Totaro, how many cases a day could New South Wales withstand at the moment before the ICU is under significant stress and we see more lives lost than should be?
I actually don't know the answer to that. I'd have to turn to our public health experts to give me advice on that.
Do you think at 200 to 300 cases a day, what you're seeing at the moment, until November where there's 80% double dose, the ICU systems could manage, or are you concerned about keeping 200 to 300 cases a day until that period?
We've been running at about 200 to 300 cases a day for a little while, and the ICUs are managing well. Yeah.
Doctor, this might be a question more suited to Dr. Cha, but perhaps you know the answer. You mentioned reconfigurations to make sure that the hospital system is on top of things. Are COVID positive patients in hospital being transferred from Sydney hospitals like yours to other hospitals, potentially Wollongong?
Not that I'm aware of.
Dr. Cha? Maybe Dr. Sorry.
Fine.